Before coming into the patient's room, I checked his chart. I washed my hands. When I come into his room, I'm going to provide for privacy, introduce myself to him, and identify him. And I also have my stethoscope clean and ready to go. So now I'm coming into the patient's room, knock knock.
Come on in.
I'm gonna provide for privacy and pull the curtain. And now I'm going to introduce myself to the patient. Hi sir, my name is Angela. I'm a student nurse. Could you please tell me your name and date of birth?
Robert Schimmel, 12/21/58.
And look at his wristband. I need to do a full head to toe assessment on you today. Is that okay?
Yep.
I have some questions I need to ask you first.
Right.
First off, do you have any pain right now in your body?
No.
Do you have headaches often?
No.
Do you have you had surgery on your head?
No.
Any trauma to your head?
No.
Do you have difficulty seeing?
No.
Do you have watery eyes, dry eyes, or red eyes at times?
No.
Do you have allergies?
No.
Do you have any upper respiratory infections?
No.
Do you have colds often?
No.
Do you have difficulty hearing?
No.
Do you have any sores in your mouth?
No.
Do you have diabetes?
Yes.
Do you have high blood pressure,
Yes.
high cholesterol,
Yes.
and do you have a history of heart attacks or heart disease?
No.
Do you have abdominal pain?
No.
And what are your urinary and bowel habits like?
They're normal.
Do you have pain while you're urinating?
No.
What about muscle weakness?
Not really.
Do you have any pain in your joints or muscles?
Pain in my shoulder, off and on.
Okay, those are the questions. Now I'm going to proceed with the assessment.
Okay.
I'm going to start with the head. And as I'm palpating your head, I don't see any lesions, and I also don't see any parasites. Your head is normal cephalic. Now I'm going to palpate your temporal mandibular joint. Can you open your mouth and say ah? Cranial nerve number 5 is intact. Now I'm going to palpate your temporal artery. And it's a +2. I'm going to do the same for this side. And it's also a +2. Now I'm going to assess your eyes. I see that both of your sclera are white, and your eyelashes, the hair distribution is even. And can you close your eyes? Or can you open them? Can you pull down your lid? Your conjunctiva is pink. Can you pull down this lid? Your conjunctiva is pink. And I don't see any opacities in your corneas. Now I'm going to do Perla. First off, your pupils are equal and they're round. And they're reactive to light. Can you follow my pen light? And your eyes are also accommodating. If we had a Snellen test, that would determine if cranial nerve number 2 was intact, but cranial nerves 3, 4, and 6 are intact. Now I'm going to look at your nose. Your nose was pink and moist on the inside, and I didn't see any deviations in your nose. And there was no discharge also. Now I'm going to look at your ears. Does this hurt when I pull your ear?
No.
What about when I push your ear? Does that hurt?
No.
Your ears are symmetrical on both sides. I'm just going to take a look and see if there's any drainage or discharge in your ear. And there isn't in the right ear. Now I'm going to look at the left ear. And I don't see any drainage or discharge in this ear either. Now well, first your lips are pink and moist and they're symmetrical. Can I look inside your mouth?
Uh-huh.
Can you stick out your tongue? So cranial nerve 12 is intact, and I noticed that you had 6 teeth.
Mm-hmm.
I noticed that your tonsils were visible, so that's a grade of 1+, and the inside of your mouth was pink and moist. Can I test your gag reflex?
Uh-huh.
Okay, cranial nerve 9 and 10 are intact because you had a gag reflex. Next, I'm going to do the neck. I'm going to palpate your lymph nodes. So the preauricular is in front of the ear, and the postauricular is behind the ear. The occipital is at the base of the skull. The tonsillar, the submental is under the chin, and the submandibular, and the postcervical. Your lymph nodes were not palpable, and that's normal because they shouldn't be palpable. And now I'm going to assess your lungs.
Okay.
So I'm going to start with the back. And first I'm going to do symmetric expansion. I'm looking for T10. Now, can you take a deep breath? Okay, it was symmetric. Now I'm going to do tactile fremitus. So when you feel my hands on you, can you please say the number 99?
99, 99, 99, 99, 99, 99, 99.
As I went down for tactile fremitus, the vibrations decreased as I went down and they were highest at the top. Now I'm going to percuss your posterior lung fields. You can see me, right? Okay, now I'm going to listen to your lung fields. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. And deep breath. Your lungs were clear on both sides. Now, I noticed that you're not showing any signs of respiratory distress, and you're not using the accessory muscles. That's a good thing. Now I'm going to percuss over your anterior lung fields, which is your front. And both times when I percussed, I heard resonance, which is just for healthy lungs. That's the sound that you should hear. Now I'm going to listen. I'm going to auscultate your anterior lung field. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. And deep breath. The patient wanted to keep his shirt on, so I allowed him to keep his shirt on. And now I'm going to assess heart sounds. This is the aortic. It's at the right second intercostal space. And I don't hear any murmurs, and the rate and rhythm are both regular. This is the pulmonic. It is right across from the aortic. It's at the left second intercostal space. I don't hear any murmurs, and the rate and rhythm are regular. I'm going to come down to Erb's point. This is the left third intercostal space. I don't hear any murmurs, and the rate and rhythm are regular. I'm going to come down to the tricuspid. The rate and rhythm are regular, and I don't hear any murmurs. Now I'm going to do the mitral. And the rate and rhythm are regular, and I don't hear any murmurs. I'm going to assess your upper extremities. I'm going to palpate your hands and your arms. There's no edema on this side. And there's no edema on this arm. The hair distribution is equal for both arms, and your skin is warm and dry and appropriate for ethnicity. I'm going to do the capillary refill of your fingers. I came back in less than 3 seconds. And I came back in less than 3 seconds. I'm going to look at your lower extremities. So the hair distribution is equal on both legs. And now I'm going to palpate your legs and feet. And there's no edema on this leg. I'm going to come around to this leg. And there's also no edema on this leg. Now I'm going to assess the capillary refill of your toes. Come around to this foot. On both feet, the refill came back in less than 3 seconds, and that's good. It's supposed to come back in less than 3 seconds. Now can I look at your abdomen? Your abdomen is round, and I don't see any lesions or masses, and I also don't see any pulsations or distended veins, and I don't see any bulges or masses. I'm going to listen to your abdomen and bowel sounds. I'm going to start at the right lower quadrant. My bowel sounds are present and active. And bowel sounds are present and active. I'm going to now go to the right upper quadrant. Bowel sounds are present and active. And bowel sounds are present and active. I'm going to go to the left upper quadrant. Bowel sounds are present and active. And bowel sounds are present and active. Bowel sounds are present and active. And bowel sounds are present and active. Now I'm going to percuss over your abdomen, beginning in the right lower quadrant. And going to the right upper quadrant. Going to the left upper quadrant. And the left lower quadrant. I heard resonance at the lower 2 quadrants, and as I went up, I heard a dull sound. Now I'm going to palpate your abdomen. I'm going to start with a light palpation, and then I'm going to do a deeper palpation. Is this tender?
No.
Is this tender?
No.
Is this tender?
No. No.
Now I'm going to do a deeper palpation. Is this tender at all?
No. No.
Is it tender? Any discomfort?
No. No.
That's the abdomen. The patient, his posture is relaxed. He's clean and well groomed. And his dress is appropriate for the season. And you said your name was Robert Schimmel.
Right.
Can you tell me where you're at? Do you know where you're at?
I'm in my home,
And do you know what year it is?
2016.
Do you know what season it is?
It's fall.
So you're alert and oriented times 3. And when I came into the room, your eyes opened spontaneously. That's a score of 4 on the Glasgow Coma scale. Can you hold my hands? And since you can obey verbal commands, that's a score of 6. And since you said it was 2016, you scored a 5. And for the Glasgow Coma scale, you scored 15. 15 means that you're fully alert. Now, I'm going to demonstrate something for you. Could you do it for me as well?
Go on the road. Get on the road, Ash.
Okay. Now can you stand with your feet together and eyes closed? And that's showing that cranial nerve number 8 is intact because he can balance. I'd like you to do as I do. We're going to do the finger to nose touch. Okay, you can have a seat now. Can you run your heel down your shin?
Both of them?
Yes, and for the other leg. Now, can you hold my hands? This is to assess strength. Can you hold my hands? The patient has a firm grip and he's strong. Now can you hold my hands? And push. Can you shrug your shoulders? And can you shrug your neck? Can you move your neck from side to side and up and down and in a circle? So cranial nerve number 11 is intact. I'm going to push and pull your feet. Can you push like you would push on a gas pedal? Do the same for this. Can you push and pull your feet? Now can you pull? Okay, now I'm going to do the Babinski reflex test. That's a positive Babinski. When I palpated your head, did you feel any tenderness?
No.
Okay, this concludes my assessment, Mr. Schimmel. Here's your call light. If you need anything, just push the button. Thank you.
Yep.